Dame Esther Rantzen is furious with Health Secretary Wes Streeting, who is believed to have told a Labour Party meeting that he won't support the new assisted dying bill because of the state of the NHS.
Dame Esther, who is terminally ill, is facing the prospect of flying abroad alone to an assisted dying clinic unless the law is changed. Well, I'm very pleased to say the broadcasting legend joins us now on the phone from home. Lovely to talk to you, Esther. We all talk about you and think of you a lot. And I know how challenged your health is at the moment. But the fact that you're speaking to us is a degree of the passion with which you want to make these points. What were your reactions, Esther, when you heard Wes Streeting's view?
Well, you know, at the age of 84, I should know better. Because it's a very, very bad idea to get cross. For two reasons. One is it's rude, and the other is it puts people off. They don't listen to you. So, first of all, I want to say that the letter I wrote to Mr. Streeting, which sounded cross, I'm rewriting to sound less cross, but I hope just as passionate. Because I was so sad that the Secretary of State for Health, a very, very influential man, wasn't following the government's advice to stay neutral if you're a minister, so that everybody could make up their own mind according to their own conscience.
I mean, Esther, just a couple of things that I'm sure he would want to clarify, and we have asked the Health Secretary for a statement as well, is that the advice from the Cabinet Secretary was that they didn't need to resolve from previously stated views, but should exercise discretion and shouldn't become part of the public debate. And Mr. Streeting has said that he was talking in a private meeting with the Parliamentary Labour Party about palliative care, but he strayed into assisted dying, and then that was leaked.
Yes, well, you see, that's the thing that these innocent politicians don't understand, is that when you talk to a group of people, it stops being a private matter because one or other of them will probably leak it. I know this is an awful shock to him, as it is to all politicians, but that was the risk he ran. So if he just said, Mr. Streeting, if he just said, I voted this way last time, but I'm still reflecting, I'm still making up my mind, because he should be. He should be listening to all voices still.
But Esther, we had Salma Shah on earlier. She's the former advisor to ministers in the past for the Conservative Party. And she said that, you know, often we say about our politicians, our ministers, that they don't really tell us what they truly believe. We never get to hear it. And on this occasion, he's told us what he thinks and he should be allowed to do so. What would you say to that?
Well, I'm sure that he's got a lot of different beliefs. I mean, for example, I think he's an ardent Christian, and that may also affect his view. But he doesn't have to say it if he's Secretary of State for Health. This is the problem. This is why ministers were asked not to express their views this time, because it's over-influential. You know, Keir Starmer has said he voted this way last time, but he's still making up his mind. Well, if the Prime Minister can do that, surely the Secretary of State should do that.
Well, Wes Streeting was speaking on Wednesday, probably after he found out how cross you were, Esther, and because you know nobody wants to annoy you. He was asked about his opposition to the new assisted dying bill.
I mean, he addresses the religion point there, Esther, doesn't he? And there will be people that have religious views, but I think that's what he's saying. He can separate his view as a politician, as a minister, away from his religion, and actually he actually claims it's soft bigotry to assume that somebody who's religious may well have certain views.
It's not exactly a soft bigotry. It's learning from experience. And when the Roman Catholic Archbishop of Westminster sends a letter to every pulpit in the land instructing Catholics to lobby their MPs to oppose the bill, you do become aware that some people regard it as their religious duty to impose their faith on others. That's what they think is right. Now, I'm not against that. I mean, I'm just against it. I think everybody has the right to choose. That's the point. And I'm sure in those previous choices you made, if you take the right to terminate a pregnancy, people will have said that would have hard cases, that has problems and potential dangers. But actually, the right of a woman to choose over her own body won out in the end. And I think I have the right to choose over my own body if I find my life is unbearable and I want to end it. And if there are two doctors and a judge making sure that it really is my view, then I think I will be protected from coercion. Though my heart goes out to anyone who tries to coerce me. But anyway, not everybody is quite this belligerent. And once again, Mr. Streeting, I should not have been cross. Never get cross.
Well, look, you are entitled to any emotions, I think, personally, whether it be anger or calm or whatever you feel. He also referenced palliative care and the system not being ready. And indeed, there, in terms of individuals' right to choose, some disability advocates also oppose assisted dying. For instance, we had Amira Griffiths on this programme last week speaking about how he feels the law could devalue some people's lives. Would you mind if we just listen to what he had to say, and then it'd be lovely to hear your thoughts?
Okay.
Essentially, what we'll be creating with this proposal is a twin-track approach where, for certain communities, the suicide prevention scheme will kick in and you'll do all you can to stop somebody from taking your life. But for certain people with certain characteristics or certain backgrounds or certain health experiences, then the question will be, we'll do all we can to support you to end your life.
What do you think about that, Dame Esther?
Well, two things. One is it's a really sad reflection on the way certain people are treated during their lives, that they feel they are so little valued. And we all need to change that. That is very, very sad and should not occur. But the other is that the majority of disabled people actually also want the choice if they become terminally ill. And this bill will only apply to people who are terminally ill, not to disabled people, not to old people, to terminally ill people, probably with around 6 months to live. That will probably, we don't know yet, but probably somewhere around there. And when it comes to palliative care, if you have a look at the Select Committee report on assisted dying around the world, you will see that it doesn't damage palliative care in some countries. It has, for example, New Zealand, they say, it has actually improved palliative care. So I think this will strengthen his palliative care in his service, not in any way weaken or damage it.
Esther, it's always fascinating to hear from you, whether you're cross or calm or anything. I know you don't want to talk about where you are health-wise personally at the moment because, you know, that's not the point of this conversation, but everybody here is so happy to hear your voice and just want you to know that, you know, we're thinking of you all the time. And how are things generally?
Well, things generally, I'm surviving. I'm talking a lot about death and assisted dying, which is a tiny bit depressing, but it wakes me up in the morning, which is very good for me. And so I'll go and have a crumpet and a bit of butter and keep my fingers crossed about this vote, because if this vote is lost on November the 29th, I don't think the law will change in time for me, but I do think thousands, hundreds of thousands of people will have to wait another decade before they get the right to choose, not to shorten their lives, but to shorten their deaths.
Oh, Dame Esther Rantzen, it's just an absolute pleasure to have you with us. You've been a fearsome voice over the years, and you're still a very powerful voice for many people even today. So thank you so much.
And enjoy your crumpet.
Thank you so much.
Sounds great.
Lovely to chat to you.
Yeah.